Hello everyone, this is going to be a nice quick conversation. Hi, Happy New Year. It's been a while. I feel like I haven't seen you guys in ages, but we're back. It's 2026 and we are moving. So tonight I decided I wanted to come on and talk to you about a topic in women's health that I think is very common. You've probably heard of it before, and if you haven't, that's okay. You'll hear about it tonight, and then now you'll know about it and know how to keep an eye out for it. So before I get into the topic, my name is Dr. Larissa Assam. I'm a board-certified family medicine physician. One disclaimer I must give is that no information I'm sharing tonight in any way, shape, or form is medical advice, okay? This is simply for educational purposes because it's important that you are well educated so that you can take better care of your health. So tonight we're going to talk about preeclampsia. I am the founder of Rofi MD. We do a lot of women's health. We specifically help women prevent complications in pregnancy. I do a lot of work around really helping women prevent complications, lose weight, frankly, all the things, okay, that you may need. So without further ado, I don't like doing long IG lives, so I like to get straight to the point. So let's get into it. What is preeclampsia? Have you ever heard of it before? Let me know in the chat. Is this something you've ever dealt with? Do you know anyone who's ever dealt with it? Are you in medicine? Is this something which you've had to manage for your patients? Let's talk in the chat. So while I look forward to your responses, I'll get into it. So what is preeclampsia? So I'll use the definition that the American College of Obstetricians and Gynecologists, ACOG. I'm going to just keep calling it ACOG from now on, okay? ACOG uses the definition, and it is defined as, it's a combination of two things, okay? First, you have to have new onset high blood pressure after 20 weeks of pregnancy, okay? So if it's before 20 weeks of pregnancy, then it doesn't classify as preeclampsia. It's something else, which we can talk about on another day, but it's not preeclampsia. So it has to be that this woman develops elevated blood pressure, and for all intents and purposes for this conversation, we're going to use 140/90 as the number. Now, it varies from place to place. It varies if you're talking to a cardiologist, obstetrician, family medicine doctor. It really does vary, right? But essentially, you have to be diagnosed with having elevated blood pressure, hypertension, after 20 weeks of pregnancy, okay? And then, in addition to that, there also has to be some type of evidence of organ stress. What does that mean? It means that in the body, there are different organs, the liver, the kidneys, etc., etc. There's something indicating that there's an organ in the body that is probably undergoing stress because of what's going on with the blood pressure. So what can this look like? It can look like protein in the urine, which would indicate that the kidneys are under stress. It could look like the liver enzymes being elevated, which would mean that the liver is under stress. It could also look like the platelets are low. It could look like there are other changes in the kidneys. It could also look like someone having persistent headaches, and I'll get into symptoms in just a minute. And even vision changes can happen as well. So, what is preeclampsia? We are learning today that preeclampsia is new onset. So, someone developing high blood pressure after 20 weeks of pregnancy, meaning if it's before 20 weeks, it's not preeclampsia. Is the blood pressure elevated? Possibly, but it is not preeclampsia, okay? Plus having organ stress. Plus having something that's evidence that there's an organ in the body, kidneys, liver, what have you, that is undergoing a degree of stress, okay? So Preeclampsia is thought to be a systemic condition, and we're often asked, what causes it? What causes it? The cause is not completely known. That's the truth. But there is the leading thought is that there is some issue that happens when the placenta is developing its blood vessels, and that is where this comes from. Now, because this is social media, I'm going to leave it there. If you come to Rofi as a client, we get into more details. We talk about prevention and what have you. The fact of the matter is that the root of preeclampsia is thought to also be tied to inflammation, because I mentioned that it's believed that there's an issue with the development of the blood vessels in the placenta, right? And so there's what we call oxidative stress, which is where you have free radicals. For my science girlies, you have free radicals coming, and they're essentially like creating damage to the blood vessels, and then as a result they're not functioning as they're supposed to. So that's how these problems start to happen. Please, if you know anyone who is at risk of this, currently pregnant, even postpartum, I would send this video to them. Also educational, so please make sure you share this video with at least 10 women that you know, because I think people really need to learn about preeclampsia and just really know what it is. Okay, and that's actually the purpose of this video. It's purely educational, no medical advice. So there are potential risk factors, and I'm not going to list the risk factors, okay, because I am also a public health professional, and I know how public health research is done, and I know how medical literature is written, and I know how risk factors are derived, and I don't want to keep perpetrating the kind of diction, so to speak, that is used. I'm not going to come here and say, oh, this race or this population is 3 times more likely to develop it because it is what it is. That's not the case. All right. Preeclampsia, unfortunately, is one of the most common complications, but the reason why the risk factors exist, this is the point I want to make, is because there's usually some type of baseline inflammation that was present. That's why the best time to get education on things like this is actually before you get pregnant in the first place. But it's never too late. So let's say you're even 30 weeks pregnant. This is good. This is the time to be learning this. And if you want to learn more about my pregnancy protocol, please, by all means, send me a message, because these things it exists to prevent such complications. Insulin resistance can be tied to it, micronutrient depletion, and that's my functional medicine brain kicking in. Now, I'll leave it there when it comes to risk factors. What are some symptoms, signs or symptoms that you should keep an eye out for? So if someone is having persistent headaches, so if this person is pregnant, they're past 20 weeks of pregnancy, and now they're having persistent headaches which are not going away even with rest. It can happen that someone has a headache, maybe they were dehydrated. That doesn't automatically signal preeclampsia. Now, if the headache is not going away, it's been going on for some time, then that's actually a reason to be more concerned. So no relief of these headaches with rest, yeah, that's a reason to look into it more. Having right upper quadrant pain. The liver is located kind of in the right upper area, so to speak, of the abdomen. So if there's pain in that area, it could mean that maybe something's going on with the liver. And again, if the blood pressure is high, putting things together, you want to make sure that this person does not have preeclampsia. Vision changes, that's another thing. What else? Having a sudden increase in weight, having swelling in the hands or in the feet, which kind of comes out of nowhere, having even shortness of breath. It can cause swelling. So even the breathing, it matters what's going on with the lungs. So that's very, very, very important. So it's important because, hello, good evening. So we want to know what these signs and these potential symptoms are. Sometimes, even from a lifestyle standpoint, a woman can have a sudden change in their exercise tolerance. Maybe you are able to walk 30 minutes or an hour, even whilst pregnant, and you are fine. But you wake up one day and now you're not able to do that anymore. Okay, if you notice that that kind of change happens, it's a good idea to just check in with your doctor, make sure that your vitals are fine, your blood pressure, heart rate, etc. And then also check to see if there are any labs that can be done just to make sure all is well. Especially, again, because we're talking about preeclampsia in particular, if it's after 20 weeks of pregnancy. Some women can even experience a disruption in their sleep pattern. Now, pregnancy, we know it may not be the easiest time to sleep, right? And more grace to all the moms, pregnant and postpartum. But if you notice like a sudden change, it's a good idea to just check. I actually think it's wisdom to have a blood pressure cuff at home, just because something can happen and you just want to check. And it's super helpful to just communicate with your doctor and say, by the way, I checked my blood pressure and it's 110/70 today, right? It's just helpful to know, especially if you've had this in the past, if you know that it runs in the family, or if high blood pressure does run in the family, it's a good idea to just keep it with you, keep a blood pressure cuff with you at home so that you can check. And then women can also experience sudden fatigue. Now, pregnancy can cause fatigue. That happens. But when it kind of comes out of nowhere, it's like sudden, then that's a cause for concern, okay? And we want to evaluate that. We want to look into that more. So there are ways to prevent preeclampsia, okay? I intentionally don't want to go into that because that can very quickly get into me giving medical advice, and I don't want to do that on social media. So I'm actually going to pause here and simply say that the purpose of this video is to educate you on what preeclampsia is. In a nutshell, it's a combination of two things. One, elevated blood pressure, right? Hypertension after 20 weeks of pregnancy, plus a sign of some type of organ distress, whether it's the kidneys, the liver, the platelets, what have you. There's some type of organ distress. That is the definition according to the American College of Obstetricians and Gynecologists. So I just want you to know that preeclampsia exists. It is possible to prevent it. If this is something that you're actively struggling with, it's important to make sure that you get the right help, right? Not just to say, oh, you have it and leave it there, but to really help rearrange your life altogether to make sure that you optimize your pregnancy. Or if you're looking to get pregnant, you make sure that you just optimize it so that you reduce the chances of this becoming an issue. Lastly, sometimes women develop preeclampsia after they've given birth, so postpartum. So just because the baby is out doesn't mean that this thing cannot come up again. And it's important to note that. So again, that habit of simply even just having a blood pressure cuff at home, really paying attention to your body, knowing yourself, it's important. So keep a blood pressure cuff at home. If nothing else, just check your blood pressure just once a week, so you at least know what your baseline is. If you can check it every day, that's even better. But if you notice that your blood pressure is getting elevated and you don't really have an explanation for why that's the case and it's persistent, those would be reasons to follow up with your doctor. So that actually brings me to the end of tonight's live. Thank you so much for tuning in. If we've never met before, hi, my name is Dr. Larissa Assam. I'm a board-certified family medicine physician, and I'm the founder and CEO of Rofi MD. We do a lot of work to help women prevent complications in pregnancy. We help women lose weight, reverse inflammation. There are quite a few other things that we do. I recently developed a pregnancy protocol, and the purpose of this protocol is to help women prevent complications such as preeclampsia. We actually meet bi-weekly on Tuesdays, and so if this is something that you know would be helpful for you, if you're looking to get pregnant, if you're currently pregnant, if you're postpartum, and in my world at Rofi, postpartum is up to a year after having a baby, by all means, please send a message, join. Be more than happy to have you on board, but don't suffer in silence, okay? We have to gain knowledge. We have to know these things. We have to know how to prevent them. If they have happened, we have to know how to manage them. Make sure that you're getting the right care, that you need. It is possible to enjoy pregnancy. It is possible to have a smooth postpartum course. It is possible. Don't believe the horror stories. That's actually not everyone's story, and it doesn't have to be your story either. So that brings me to the end of tonight's session. Thank you so much for tuning in. Please share this with at least 10 women who you believe will benefit from this video. God bless you. I'll see you next week. Bye.